Good day, everyone. I am Nikki
And I am Esther Morales.
and we are from BSN 3B of the University of St. LaSalle. Today, we're going to talk about dengue.
We are living in a tropical country, a country endowed with rainy and sunny weathers. However, this kind of weather brought about many deadly diseases, and one of these is dengue, or also known as dengue hemorrhagic fever. Dengue is usually caused by the bite of a Aedes aegypti mosquito that is infected by the virus. This mosquito usually bites during the day and lays its egg in the stagnant water. The signs and symptoms of dengue are similar to that of flu. There is sudden onset of high fever, which lasted for 3 to 7 days. The patient also experiences joint and muscle pain and of course abdominal pain. Complete blood count will show platelet count of less than 150,000 per cubic millimeter. In this case, bleeding may occur. There is nosebleed or epistaxis, then hematemesis or vomiting of blood, and of course, bleeding in the gums. Dengue is diagnosed
Through a test called tourniquet test, wherein we apply pressure in the upper arm of the patient with the use of BP apparatus, and that will be lasted for 5 minutes. After 5 minutes, there is a presence of pinpoint red rashes, which is called petechiae. This is an example of petechiae rash. Petechiae rash is the defining signs of dengue. It is also an indication that there is bleeding underneath the skin due to the rupture of small blood vessels. This is the tourniquet test.
There is no known treatment for dengue, only symptomatic and supportive care. We give the patient paracetamol if he or she is having high temperature. Aspirin should not be given because aspirin causes bleeding. We also perform keep-it sponge bath or sponge bath alone to lower down the temperature of the febrile patient. We should also advise the patient not to eat foods that are colored or dark-colored foods since it could mask bleeding. Oral hydration or increase in oral intake should be advised to the patient to prevent dehydration. We also perform IV infusion so that we could also prevent the dehydration of the patient.
Prevention of dengue starts at home. A simple cleaning of surroundings is one way to help prevent dengue. Number 1, we should cover water pails and water traps to prevent the mosquitoes from breeding. And of course, we should change the water in the vases at least twice a week. And also, we should scrub the sides of the pails and traps in order to remove the eggs of the mosquitoes. Then, we should not wear light-colored shirts in order not to attract the mosquitoes.
As a conclusion, dengue has no treatment and prevention should always start at home. We should always remember that
An ounce of prevention is better than a pound of cure.
that's all for now. Bye!